According to the World Health Organization, depression is one of the most common mental disorders worldwide, affecting over 260 million people. Depression can be crippling and frustrating. It can affect your ability to function not just at work and school, but also with your relationships. Depression can cause you to feel sad all the time, experience fatigue, poor motivation, decreased appetite, weight loss, and sleep problems. In severe cases, it can even lead to suicidal thoughts and behaviors. The terrible effects of depression make it essential to treat this condition so you can lead a normal life. For several years, medications and counseling have been the mainstays for depression treatment. Today, we'll shed some light on Spravato and TMS, discussing their benefits, how they work, and their efficacy will help you make an educated decision on treatment for your depression. Of course, this should be done with the help and guidance of your doctor. What is transcranial magnetic stimulation, TMS? Let us start with transcranial magnetic stimulation. TMS is a procedure that uses magnetic pulses to treat depression. It was approved for depression treatment in the US in 2008. TMS is done as a day treatment in a doctor's office. It involves applying magnetic fields to specific parts of your brain that affect your mood and cause you to be depressed. This process helps your brain cells release chemicals that make your depression better. A TMS session lasts about 20 minutes. There is a faster protocol known as the theta burst, which lasts only 3 minutes. An entire course of TMS treatment is 36 sessions. Usually, treatment is done 5 days a week for 6 weeks, with a slow taper over the next 3 weeks. This makes it a total of about 9 weeks. You can drive yourself back to work or home after each treatment. Studies show that approximately 50 to 60% of people with depression who have tried and failed to receive benefits from medications experience a clinically meaningful response with TMS. What is esketamine Spravato? Now let's talk about esketamine or Spravato. In 2019, esketamine was approved in the United States as an antidepressant. Janssen Pharmaceuticals markets this medication under the brand name Spravato. Spravato is the first approved nasal spray medication for treatment-resistant depression in adults. It also has approval for depressive symptoms in adults who have major depressive disorder with acute suicidal ideation or behavior. Spravato improves your mood by increasing a brain chemical called glutamate. Most other antidepressants primarily work by increasing brain serotonin, not glutamate. Spravato is only used in adults. It is not for use in children. Also, Spravato is not a first-line medication. It is only prescribed if you have tried and failed at least 2 other antidepressants. One exciting fact about Spravato is that it can work quite quickly. This nasal spray relieves depressive symptoms within hours to days, much faster than other medications used to treat depression. Spravato is only given in REMS-certified treatment centers. It cannot be taken at home. Do not eat at least 2 hours before your dose and do not drink any fluids 30 minutes prior. The treatment center will monitor you for 2 hours after your dose to ensure you have no side effects. Also, you can only drive the next day following a restful sleep. Which is more effective, TMS or Spravato? Esketamine and TMS are helpful treatments, but which one is more effective? Both of these treatments have shown promising results in depression treatment. Studies have shown response rates for esketamine around 50% or higher. These studies also often show rapid and substantial improvement in depressive symptoms. In some cases, esketamine provides rapid relief of depressive symptoms within hours or days of the first dose. Numerous studies have also shown the effectiveness of TMS. According to research, response rates for TMS are 50% or higher. This positive response can last for several months or even years. Which treatment option is best for you? The choice between esketamine and Spravato depends on many factors, including recommendations from your healthcare provider, your preference, and your ongoing issues and needs. TMS is not a medication, does not get into your system, and has minimal side effects. It also does not make you drowsy. You can drive after treatment. Some may find this beneficial. Some may prefer esketamine as it tends to work quickly, and you may feel better within hours or days. It can be a difficult decision to make, but talking with your mental health provider should help with this. The good news is that both esketamine and TMS are effective options for treatment-resistant depression.